Hi, my name is Dr. G. Balamurali. I'm a spine and neurosurgeon at Kauvery Hospital. I specialize mainly in spinal surgery. Today we're going to talk about myths of spinal surgery. If you look at all the spinal problems and spinal conditions, majority of the problems related to the spine can be dealt with just lifestyle modification, pain relief, and physiotherapy, and other methods of non-surgical type. Only about 5 to 10% of problems are really serious in the spine. And of this, only 2 to 3% of problems are very serious, which include like infection, TB, tumors, fracture, and other things. Spine problems can happen at any age, but more commonly they are seen in people between the age group of about 40 to 70. So younger people are very unlikely to develop problems, but in today's world we do see a lot of younger people because of their lifestyle. Now, coming to the myths of spine surgery, most people have this thought that spine surgery is very complicated, should not be done, should be done only at the last resort. Never you should have a spine surgery, you would be bedbound, you cannot get back to normal activities in life. And it would restrict you and you can never be a normal person. Well, as the topic itself says, this is all a myth. So spine surgery is very safe. Spine surgery has the advantage that it can get you relieved of your symptoms, mainly pain, and can get relieved of disability. So if you look at each of those points, complications are very rare. So complications happen in probably less than 1 or 2% of people. And it also depends on what type of surgery. If it is a very major problem, a major surgery is required, then the complications are much higher. If the problems are related to a minor problem like a disc problem or a compression in the spine, the complications are almost nil. So that is one very important thing you should understand, that the complications are related to the problem. So never compare saying that somebody else you have seen operated did not do well, or I have seen a patient who had surgery and he never walked. So their problem may be totally different to what your problem is. Secondly, the technology is so far advanced that we are able to do spine surgery very safely. We have a lot of new monitoring, we have navigation, we have computer assisted, we have robotic assisted surgery. So spine surgery is very safe. We have all of these in Kauvery Hospital and we do them on a regular basis. The next thing is getting back to normal. Well, the intention of doing spine surgery is actually to get you back to doing your normal walking. You want to be able to climb up stairs, you want to sit down, you want to play a game, you want to swim, you want to go back to work. So that is the intention of spine surgery. So it is very wrong to say that you can never get back to normal. Almost 98% of patients that we operate who come in a reasonable good state will go back to what they were doing before. The next thing is failure. Yes, some problems are very serious. If you are totally paralyzed from a fracture, you can be paralyzed for the rest of your life. So failure from spine surgery is extremely small. And it also depends on who operates on your spine. So spine surgery is so vast that you need to go to a proper specialist who is well trained in spine surgery, and in their hands the results are very good. Now the last thing is that people always feel that the spine surgery should be left as the last resort. So I think that is a very, very wrong intention and a wrong attitude. Because once you leave it to the end, when your spine problems become really bad, then your results are not going to be successful. Because your surgery is more complicated. A problem which can be fixed early will give you better results than a problem that's been left very late and then you try to repair that problem. So just to conclude, we do several types of spine surgery at Kauvery. We do open surgery. Majority of surgeries we do through keyhole, called minimally invasive spine surgery. We do endoscopic surgery, robotic guided surgery. So spine surgery is definitely safe. The right people need surgery. As I said again, 90% of problems can be managed without surgery, but those who require surgery, earlier surgery in safe hands is always better. Thank you.